If I told you that every single day you might be slowly damaging your kidneys just by eating something sitting in your kitchen right now, would you believe me? Not something toxic or unfamiliar, but something you've trusted for years, something you may even believe is healthy. And here's the most dangerous part. You won't feel it happening. There's no pain, no clear warning signs, nothing that tells you something is wrong. Until one day you're sitting in a doctor's office, looking at your lab results, and realizing the damage has already gone too far. This is what makes kidney disease so dangerous. It doesn't announce itself. It builds quietly over years, sometimes decades, while everything feels completely normal. I'm Dr. Michael Carter, and today I'm going to walk you through 5 hidden threats that could be silently weakening your kidneys right now, especially if you're over the age of 50. Some of these might surprise you because they don't look dangerous and they don't feel dangerous. In fact, one of them is something millions of health-conscious people consume every single day, believing they're doing the right thing. But before we get into that, you need to understand something most people never think about. Your kidneys are working for you right now every second, filtering your blood, removing toxins, balancing everything that keeps your body stable and alive. And yet they can lose more than half of their function before you notice anything at all. So the real question is not whether something is wrong. The real question is, what have you been doing for years without realizing the cost? Let's take a closer look. Before we talk about what's harming your kidneys, you need to understand why this matters more than most people realize. Over the years, I've seen a pattern that repeats itself again and again. People come into the clinic feeling completely fine. No major symptoms, no serious complaints. Maybe a little fatigue. Maybe some swelling they brush off as normal aging. And then their lab results come back and everything changes. They're shocked because nothing hurt, nothing warned them. That's the nature of how kidney damage works. Your kidneys are not like your back or your joints. They don't send strong pain signals when something is wrong. In fact, they can lose a significant portion of their function quietly while your body continues to operate as if everything is normal. By the time most people realize there's a problem, the damage has already been building for years. So the real danger isn't just what harms your kidneys, it's what harms them without you noticing. Let's start with something that almost everyone underestimates. The 5th hidden threat is dehydration you don't. Here's a situation I want you to recognize. You wake up in the morning, have a cup of coffee, maybe go about your day running errands or working around the house, and hours pass before you drink any water. You don't feel particularly thirsty, so it doesn't seem like a problem. But as we age, the body's thirst mechanism becomes less reliable. The signal that tells you to drink water becomes weaker and slower, so you can be mildly dehydrated for long periods of time without realizing it. And that's where the stress on your kidneys begins. Your kidneys rely on a steady flow of fluid to filter waste out of your blood. When you're dehydrated, that flow slows down. Waste products become more concentrated, and the kidneys are forced to work harder under less ideal conditions. Over time, this creates a kind of low-level strain that doesn't cause immediate symptoms but gradually wears down the system. It's not one day that causes the damage. It's hundreds of small days like this repeated over years. The solution here is simple, but it requires intention. Don't wait until you feel thirsty. Build hydration into your routine. Glass of water when you wake up, another between meals, and paying attention to simple signals like the color of your urine can make a meaningful difference over time. Now, the next threat is something that often surprises people, especially those who are trying to stay healthy. Excess protein. You've probably heard that protein is important, especially as you get older. It helps maintain muscle, supports recovery, and keeps your body strong. And all of that is true, but what most people don't realize is that more is not always better. I've spoken to many individuals who start adding protein shakes to their daily routine, sometimes on top of an already protein-rich diet, believing they're doing something beneficial. And in moderation, protein is essential. But in excess, it places a significant workload on the kidneys. Here's why. When your body processes protein, it produces waste products that must be filtered out through the kidneys. The more protein you consume, the more of this waste is generated. In a younger person with fully functioning kidneys, the body can usually handle this without issue. But as kidney function naturally declines with age, that extra workload becomes more significant. At a biological level, this means your kidneys are being asked to filter more often with less reserve capacity. Over time, that added pressure can contribute to gradual wear and tear on the filtration system. This doesn't mean you need to avoid protein. It means you need to be mindful of how much you're consuming and where it's coming from. Many people benefit from shifting toward more balanced portions and incorporating plant-based protein sources, which tend to be easier on the kidneys. Because again, the goal isn't to eliminate what's good for you. It's to avoid turning something beneficial into something harmful through excess. Now, the next threat is one that almost everyone has used at some point, and many people rely on far more often than they realize. Painkillers. Think about this for a moment. Maybe your knees ache when the weather changes. Maybe your lower back bothers you after a long day. So you reach into your medicine cabinet, take a pill, and move on. It feels harmless. After all, these medications are available over the counter, widely used, and trusted by millions. But what most people don't realize is that regular use of certain pain relievers can quietly reduce blood flow to the kidneys. Medications like ibuprofen or naproxen work by blocking substances in the body that cause inflammation and pain. That's why they're so effective. But those same substances also play an important role in keeping blood vessels inside the kidneys open and functioning properly. When they are blocked, those tiny blood vessels can constrict. Blood flow decreases, and the kidney's filtration system doesn't receive the oxygen and nutrients it needs to function at its best. In the short term, your body can compensate. But when this becomes a habit, days turning into weeks, weeks into months, the effect begins to accumulate. The filtration units inside the kidneys are placed under repeated stress, and over time, that stress can lead to permanent damage. What makes this especially concerning is how easy it is to overlook. There's no immediate signal telling you something is wrong. The relief from pain reinforces the behavior while the underlying impact goes unnoticed. The smarter approach is not to avoid these medications entirely, but to use them with awareness. If you find yourself taking them regularly, it's worth having a conversation with your doctor. There may be alternative strategies for managing chronic pain that don't carry the same level of risk to your kidneys, because solving one problem should never quietly create another. Now let's move to another threat that is even more widespread and often dismissed because the effects are not immediate: sugar and processed foods. This one doesn't damage your kidneys overnight. It works indirectly, slowly, and over time. And that's exactly why it's so dangerous. Imagine a typical day. A sweet drink in the afternoon, packaged snacks, maybe a quick processed meal for convenience. None of these choices feel extreme on their own. But together, repeated day after day, they begin to shape your internal environment in ways you don't immediately see. High sugar intake increases the risk of developing insulin resistance and eventually diabetes. And diabetes is one of the leading causes of kidney damage worldwide. At the same time, many processed foods are loaded with sodium. Excess sodium raises blood pressure, and high blood pressure puts constant strain on the delicate blood vessels inside the kidneys. Over time, those vessels begin to stiffen and narrow, reducing the kidney's ability to filter blood effectively. So while it may not feel like you're directly harming your kidneys, the reality is that you're creating the exact conditions that lead to long-term damage. The solution here isn't perfection. It's awareness and gradual change. Reducing your reliance on heavily processed foods, paying attention to added sugars, and being mindful of sodium intake can significantly lower the burden placed on your kidneys over time. Because once again, the issue is not a single decision. It's the pattern those decisions create over the years. Now we come to what I consider the most overlooked and in many ways the most frustrating threat of them all: because this is not something people do out of carelessness. This is something people do because they're trying to be healthy. Let me paint you a picture. You start your morning with a green smoothie, maybe spinach almond milk, a few healthy add-ins. You've read about the benefits, you've made it part of your routine. It feels like a smart, responsible choice, and in many ways it is. But here's the part. Almost no one explains clearly. Some of the foods most commonly labeled as healthy contain naturally occurring compounds called oxalates. On their own, oxalates are not inherently harmful. Your body can usually process and eliminate them without issue. But when intake becomes too high or when kidney function is already reduced, things start to change. Instead of being safely eliminated, oxalates enter the bloodstream and are filtered by the kidneys. And this is where the problem begins. Inside the kidneys, oxalates have a tendency to bind with calcium. When the concentration becomes too high, they can form tiny crystals. At first, these crystals are microscopic. You won't feel them. You won't notice anything unusual. But over time, they can accumulate. Those crystals can irritate the delicate structures inside the kidneys, triggering inflammation and contributing to the formation of kidney stones. And beyond the acute pain of a stone, repeated exposure can lead to gradual damage within the kidney tissue itself. What makes this so concerning is the pattern I see again and again. People who are consistently consuming large amounts of high oxalate foods every single day, believing they are making the best possible choices for their health. Foods like spinach, almonds, beetroot, dark chocolate, all widely promoted, all beneficial in the right context, but potentially problematic when consumed in large amounts, especially without balance. And no one ever told them. That's the part that matters. They weren't neglecting their health. They were actively trying to improve it. So what should you do? The goal is not to eliminate these foods completely. It's to change how you use them. Variety matters. Instead of eating the same high oxalate foods every day, rotate your choices. Mix in alternatives that are lower in oxalates so your body isn't dealing with the same load continuously. Pairing also matters. Consuming calcium-rich foods alongside high oxalate foods can help bind oxalates in the digestive system before they are absorbed, reducing the burden on your kidneys. And hydration once again plays a key role. Adequate water intake helps dilute the concentration of oxalates in the urine, lowering the risk of crystal formation. Because when it comes to this particular threat, the issue isn't the food itself, it's the pattern. And once you understand that you can make small adjustments that significantly reduce the risk without giving up the foods you enjoy. So when you take a step back and look at everything we've talked about today, a clear pattern starts to emerge. It's rarely one single thing that damages your kidneys. More often, it's the small repeated habits that feel completely normal on the surface, but slowly add up over time. Not drinking enough water because you don't feel thirsty, adding more protein than your body actually needs. Relying too often on pain relievers or regularly consuming processed foods without thinking about their long-term effects. Even some of the choices that seems the healthiest can become part of the problem when they are repeated in the same way every single day. And in my experience, this is where most people get caught off guard. They're not ignoring their health. They're trying to do the right thing. But without the right information, even good intentions can lead to the wrong outcomes over time. Now, I want to be very clear about something. This video is not meant to diagnose, treat, or replace the guidance of your personal physician. Everyone's body is different, and your specific health situation, especially if you have existing conditions, requires individual evaluation and proper medical advice. What this is meant to do is give you awareness, because awareness is often the difference between catching a problem early and discovering it when it's already advanced. Your kidneys are remarkably resilient. They've been working for you every single day of your life, quietly filtering, balancing, and protecting your body without asking for attention. What they need from you now is not perfection, it's consistency. Small, thoughtful adjustments, drinking water more intentionally, being mindful with medications, creating variety in your diet instead of repeating the same patterns, and paying attention to what your body might not be telling you directly. Because the goal here is not just to avoid disease, it's to stay active, independent, and fully present in your life for as many years as possible. And that begins with the choices you make while everything still feels fine. Now, I'd like to hear from you. Before watching this, had you ever heard about how some so called healthy foods could affect your kidneys in this way, or was there something today that genuinely surprised you? Leave a comment below and share your thoughts. I read them and they often shape what we talk about next. And if you know someone who is trying to take better care of their health, consider sharing this with them. It might help them avoid a mistake they didn't even know they were making. If you found this helpful, make sure you're subscribed so you don't miss future videos where we break down complex health topics into clear, practical insights you can actually use. I'm Dr. Michael Carter. Thank you for taking the time to take care of something that has been taking care of you your entire life.